Thank you very much, Madam Chairman and committee members. SB 1283 addresses an important consumer problem that was brought to the attention of the Senate Select Committee on Autism, chaired by Senator Steinberg, who conveys his appreciation to you and other members of the committee for your leadership on this issue. SB 1283 is intended to expedite the resolution of appeals and grievances that are filed by consumers with the Department of Managed Health Care. Current law requires the DMHC to provide a final disposition of the grievance within 30 calendar days unless the DMHC director deems that an additional time is needed. Consumers indicate that in some cases, especially in autism-related appeals, delays of many months have occurred. These delays may have really serious consequences for kids who need treatment. SB 1283 simply clarifies the law so that consumers get a decision to their complaint within 30 days of providing the relevant information. SB 1283 is a step in the right direction to ensure that the grievances submitted to DMHC are evaluated in an appropriate and timely manner. We appreciate the recommendations, the recommended amendments in the committee analysis, and Senator Steinberg is happy to accept all of these amendments as author's amendments. There is no known opposition to this bill. Testifying today in support of the measure are Ms. Feda Al-Malidi, who's the proud parent of 3 boys, one of whom has been diagnosed with autism spectrum disorder, and also the founder of several parent advocacy support groups. Also Dr. Beth Capel, who is the policy advocate for health access, and several others. Thank you.
Go ahead, please.
Hello. My name is Feda. This is my son, Mohammed. He's 5 years old. He has autism. I want to thank Senator Steinberg for authoring this legislation, and also to say that I serve at the pleasure of Senator Alquist on her Bay Area Regional Autism Task Force. Almost 2 years ago, I battled with my insurance company to get treatment for Mohammed. Once I appealed my health plan's denial to the Department of Managed Health Care, DMHC, the process took about 60 days. This was literally the most terrifying time of my life. Imagine yourself waiting for 60 days to find out whether your child was going to get the treatment that he so desperately needed and was entitled to. I pay my health care premiums every month. Now, let me give you an example of another family. This family had the misfortune to come after me after the department changed their policies, and appeals are now taking anywhere from 6 months to more than a year. October 2008, the parent calls to request ABA services for their son. ABA stands for Applied Behavioral Analysis. It is the standard treatment for autism, similar to insulin for diabetes. The treatment was denied. January 2009, 3 months later, they went to the Department of Managed Health Care to file a complaint. July 2009, 9 months later, after repeated requests from the Department of Managed Health Care to the parents for more information, the DMHC finds that ABA is a covered benefit. This part of the process took 6 months. According to DMHC's own policy, it should have only taken 7 days. The appeal process should end here and treatment should begin. Instead, Blue Shield refused to follow DMHC's orders and made up a new reason for denial, with no penalty for delay. October 2009, 3 months later, the DMHC finally decides to send the case to medical review. The 7-day process has now taken over 9 months. November 2009, the Medical Review Board found that the treatment to be medically necessary. By law, Blue Shield must authorize treatment within 5 days at a $5,000 a day fine if they don't. Blue Shield refuses yet again and doesn't authorize treatment for 45 days. By statute, Blue Shield should have been fined $225,000, yet no fines were levied against them. Today, it's April 21st, 2010. 18 months have gone by. Blue Shield signed a contract with the provider, but has denied every claim and has yet to pay for a single hour of treatment.
And you will need to close, please.
Basically, this family is one of the lucky families. They actually have a decision. So many families are languishing in the process. The process that should have only taken 30 days took over a year and a half. ABA is the standard treatment for autism. These children need to start therapy as early as possible.
Beth Capel on behalf of Health Access California. A decade ago, listening to stories like this from families who face similar challenges with many conditions, we sponsored the Patient Bill of Rights that was enacted into law in 1999. We have worked hard to implement that in the best way that we could, but we have not revisited the provisions relating to grievance and appeals since then. And this complaints by families like this suggest to us that there is the need for this legislation to begin that process of revisiting the law that we put in place a decade ago and making sure that it's working in the way that it was intended to get families the care they need when they need it and not to put them through Dickensian delays. For that reason, we're proud to be in support of this bill.
Jim Gross on behalf of the California Association of Applied Behavior Analysis in support of the bill.
Thank you.
Charles Bakke with the California Association of Health Plans. We don't currently have an official position on the bill, but we'd like to work with the author and his staff to ensure that the timeframes are workable for our health plans in responding to requests from the Department of Managed Health Care. Thank you.
That would be fine, and I think we have someone else in support.
Excuse my tardiness. Busy day for all of us.
We have had both witnesses 2 minutes. If you would just...
Absolutely. Madam Chair and members, Rick Rollins on behalf of the Alliance of California Autism Organizations and Alliance of 42 statewide parent-based organizations, the Association of Regional Center Agencies, the Center for Autism and Related Disorders, the Sacramento-based ABC schools, and the Behavioral Intervention Association are all in support of this bill as to be amended.
Thank you very much.
Marty Moto, California Disability Community Action Network, in strong support.
Thank you very much. Is there opposition? No opposition. Comments from committee?
I'd be glad to move the bill. Opposition is even. We don't have a quorum yet.
No, we don't. Okay. We will talk about that in a moment.
Sorry.
Thank you, Doctor. And
when it becomes appropriate, that would be great.
yes. Would you like to make a very brief comment in closing?
Just my appreciation to so many of your colleagues for their support on this issue. Thank you very much.
Thank you very much. We do have 4 senators present. We need one more to establish the